Hello, everybody. This is Michael Waxman-Lenz. I'm the CEO of the American Technion Society. We're just giving the system a moment to have everybody join to our first, what we call Live from Israel, webinars from Technion experts. So we're very excited to welcome a very large audience from Technion supporters, really from around the world. There will be several hundred people joining this event, and we're equally excited to welcome Avi Schroeder, who is the Technion professor. He's the associate professor of chemical engineering and adjunct associate professor of biomedical engineering. I'll give a little bit of context for him in a moment. But first, let me welcome all of you. I hope that you and your families are safe and healthy during this very unprecedented time in our lives. And with these dramatic changes that we're all experiencing and that are caused by the coronavirus, we at the American Technion Society have been exploring ways how we can stay connected with you and keep the community connected. And this effort, in order to address this new environment and disseminate information, is this Live from Israel webinars from Technion experts. So welcome to this weekly virtual speaker series and this inaugural event. As I said, we're welcoming our dear colleague, Professor Avi Schroeder from the Chemical Engineering Department. He's also the head of the Lewis Family Laboratory for Targeted Drug Delivery and Personalized Medicine Technologies. And if by any chance Jeff Lewis is on this call, we want to thank him and his family for the support of Avi's groundbreaking research. And in fact, as far as I know, Jeff and much of his family were in Israel just last summer for the dedication of this lab. And Jeff's father, Norman, was the third president of our ATS chapter in Los Angeles. And we're really honored if Jeff is on, that he has continued his family involvement and support of the Technion, which is a very regular occurrence that we have generations of supporters. So let me introduce all the other speakers, and let me also give a few logistical hints for all the participants. So Professor Schroeder will present first, and then we'll be joined by Technion Student Association officers, Linoy Nagar-Scholl, who's the chair, and Ido Ren, who's the vice chair, who you see up there on the videos as well. And as logistics hint, if you have questions for any of the speakers during the course of the call, please use the Q&A functionality. There's a little feature at the bottom of your screen where you can submit questions. We will hold all the questions until after the presentation, and then my colleague David Kivo will moderate the conversation. So please use the functionality, submit your questions. And as I mentioned, we'll begin with Professor Schroeder, who will give us a little bit of a context where he is, what he's doing right now, and then we look forward to learning about his research, as you will find out has some connection to also the COVID-19 pandemic. That's why we picked him as the first speaker for this series. And so, Avi, I'll turn the program over to you. Thank you for joining.
Hi, everyone. Thank you so much for joining this evening. This is Avi Schroeder. I hope you can hear me well. As you see, I'm not speaking from my office at the Technion or from my Technion lab. I was actually called up to the IDF Homefront Command as an expert from the Technion to aid with the way the country, Israel, will deal with COVID-19. And I'll say that we're supporting Israel, but we're also supporting other countries around the world. Really, thankfully, Israel is dealing very, very seriously with this viral infection and or pandemic. So I'm proud to be part of this force, and I hope we end this really rough time with as few casualties as possible. and that we all return to normal life and good health as soon as we can. So just a couple words about what we do at Technion and how this is related to COVID-19. So most of our work in the lab is focused on personalized medicine, especially around cancer medicine and the treatment of neurodegenerative diseases such as Parkinson's disease and Alzheimer. However, several years ago, we started working on a project which was a little outside the boundaries of what I thought at the time was something very important, but it was very interesting. And actually, I was approached by two entrepreneurs who asked if we can help them solving a problem in aquaculture. Specifically, they asked me about shrimp, and I must say I was a bit surprised. I'm a kosher eater myself, and I never tasted a shrimp. And they told me about viral diseases that impact growing shrimp all around the world. In fact, in aquaculture, viral diseases are the main threat to growing shrimp and fish and other sea animals. And they asked me if we can adapt technologies we're developing for treating cancer patients for treating the shrimp and actually protecting them against this viral disease. The viral disease itself was called white spot syndrome. That's the name. And and what we did over the past 5 years is we actually developed unique food that we give to the water where the aquatic animals live. They eat this special medical food, and it protects them against viral diseases by boosting their immune system and by actually eradicating the virus inside the body. And I have to say that was pretty much our work on viral diseases until COVID-19 pandemic entered. We had a great tool for protecting animals against viral diseases. In fact, today the greatest or the largest manufacturer of feed in Europe is a partner, and a very large firm in Singapore supports this research. But we didn't make the cross to humans. And when this pandemic broke and we understood how important it is to protect all of us from viral diseases, we understood, but we maybe didn't fully see the connection between the research we were doing to how we can protect the people. Immediately, we noticed then when the pandemic broke is that we can actually use this technology not only for protecting animals, but also for protecting us. And I'll say that the Technion has been amazing. Since this pandemic opened, they approved that our lab continue working full thrust forward in order to develop this technology for treating patients and actually protecting us against COVID-19. Maybe I'll say a couple words just about the virus itself. I think we all are aware that it's an extremely contagious virus, and as such, it actually we need to distance ourselves one from another. Especially people that live in one home shouldn't be in contact with people that live in another home. And I think what we're trying to educate people here, also through the IDF and also through the State of Israel, is that the people most at risk are the people who we love very much, or maybe even love most, our parents and our grandparents, our older brothers and sisters, who are most risk or greatest risk from COVID-19. And here in Israel, one of the things we're trying to do through the IDF and through our Technion experience is to explain that we can love people also from afar, using video conference calls as we're doing right now, or calling our relatives more often, but trying not to actually come close to our relatives that are that are adult relatives. And I think that's one very important key. The second key is really maintaining hygiene, washing our hands often, and trying not to go outside for unnecessary errands. Things that we don't really have to go out of the home to do, we shouldn't be going out. I'm now in the Army. The Army called me up here to help, but I'll tell you that my entire family is at home. And when I come home, because I am here doing this duty, I come home, I take my shoes off before I enter the home, and then I take my uniform off immediately and go to take a shower with soap and water. And I wash my uniform separately from the other clothes of the rest of the family. These are practices that I hope will protect both myself, but more important, the people I love so much in my family, my wife, and our children. So I hope every one of us, we're all very concerned during this time. And the way we should act is by loving through phone calls and not loving through hugging and kisses, at this time at least. And the second thing is we should try to keep ourselves in quarantine and not allow the virus into our homes. That's very, very important at this time. Together, at the same time, I want to tell everyone that we're working very hard to bring a new vaccine for treating from COVID-19. It seems that we will have to take several measures, and we're working on all of them simultaneously. In our lab, on one of the measures, a vaccine that will actually prevent the virus from multiplying inside our cells. And other labs at Technion are also working on other aspects of COVID-19. So shalom from Israel. I'm staying on this call, and I'll be open soon to take any of your questions. We have very exciting people here on the panel. And thank you so much again for your support, but even more so for protecting each other and for being caring and thoughtful about how we deal with this situation of COVID-19.
Thank you so much, Avi. Are you able to talk a little bit about what your work entails with the IDF right now?
Yeah, so the IDF faces several different issues. One is in Israel is versus civilians, and the IDF is actually helping in places where the other offices of government aren't able, just because the IDF is a very well-trained body. So the IDF opened hotels for people that were infected by COVID-19, and they're housed there because there's not enough room in the hospitals for patients that are not in severe condition. So those patients we prefer to distance from their families, but not to take hospital beds. So the IDF took over that. Furthermore, we have major issues here of how we protect the IDF itself from becoming infected. And I'll say that each unit, I can't go into specifics, but each unit has its own measures. And as you all know, even though we have a viral infection or a viral pandemic all around the world, our enemies don't rest. And we need to be very careful that they don't take advantage of this time to attack Israel. And we're making sure that the IDF is as strong as ever so that we can protect the people living here in Israel. And we're taking all the measures necessary to make sure that if a unit is infected, we can, as soon as possible, bring it back to work. And making sure also that as few as possible soldiers are actually infected by the IDF. Some of the measures the IDF has taken have been publicized, and I can share them with you today, such as closing some of the units. A lot of the soldiers here are going to stay in their own units in quarantine for a period of about at least 1 month, maybe even longer, till the pandemic ends, to make sure that no viruses enter their units. Other measures that I prefer not to share, but I'll share with you tonight are the food is terrible at this time because everything is kept. Yeah, usually the food in the IDF is really tasty, but here it's not good. It's not good, but there's nothing we can do about it. Everything comes in these paper bags, which have been pretty much autoclaved, meaning heated. So it gives you the calories, but none of the taste. So that's pretty much what we're having here, but it's worth it. I mean, as much as we can protect ourselves, the better.
Thank you, Avi. First of all, to all the listeners who may have logged in a little bit later, you're listening to Avi Schroeder, who's coming from us from an IDF base. And so if you hear a little bit of static, it depends on the connection speeds from the base. If you have questions, please use the Q&A feature on the bottom of your screen, and you can submit questions directly that will go later to Avi and also to our other two speakers who I want to turn to now. And so Linoy and Ido, we would like you to share some of the important work that the Technion Student Association is doing to support your fellow students that have been quarantined. Linoy?
Okay. Hi, everyone. First of all, thank you for inviting us. We are very happy to be here with you. I'm on my dorms here in the Technion. This is the third day that I'm at home because we are here in Israel, as Avi said, we need to stay home and not be in contact with many people. The last weeks, we did a lot for students that need to be in isolation. There is many students at campus that are without families and help and even money to buy products, medicine, and food. We provided the groceries for those students that was in isolation here at the dorms and outside the campus. Medicine, and we also protect and promote their academic rights in this time. There were various students who missed out their tests and exams, and they were very nervous. So we work in collaboration with the Technion management, which I'm very happy to tell you in this forum that we have great cooperation with the Technion management, and we get the fully support from everyone. And I'm very proud to be part of this system. I'm a student in my fourth year in material science and engineering with chemistry also. And I hope that the semester will go better and that everything will go as we expect. I want to keep and study here at the Technion to master studies. And I want Ido to tell you more about our last adventures.
Thank you. Ido?
So, hello everybody. We are doing lots of activities to help the students. If it's students that lived in the dorms, and there are about 5,000 students. So we think day and night, all the people that work in the student association about ways to help. If it's food and groceries, like Illinois said, and if it could be even activities and groups of students that train together at their homes. We even broadcast yesterday a podcast about this situation of the corona, and students really liked it. The comments were very good. Beside that, a lot of students want to volunteer and help, not only inside the campus, all over Haifa. People using their own cars and going to schools and send food and video chatting older people and people that need help. The solidarity and the activities, it's really amazing and touching. And beside that, especially Illinois, with the management of the Technion, they are working day and night about the academy situation and what will happen with the tests, and to help the students to understand how to participate through Zoom and all the classes. It's new to us, and I think the Technion and the association, we working in such a way that help us to go through the situation in a good way. Another thing that we do is all the time, people are in their houses. It's a new and strange situation. So we're trying to bring them the knowledge as soon as possible. And so if it's through Facebook and Instagram and all the platforms that are available to give information as soon as possible, so that all the students will be connected and that they know that they have one address to ask a lot of questions. So all the students that work in the association, that their phone ringing non-stop, because people have lots of questions. But I think even though it's a hard situation, I think people are, signing in and giving their shoulder, and everybody's helping. And we are optimistic. We think that it looks like and it feels like the situation is under control. So we are positive and optimistic that in a few weeks we'll go back to normal.
Thank you so much, Ido. I love I've always loved the attitude of my Israeli colleagues and friends, how they deal with adversity, and you certainly both epitomize that. So I'm going to turn over the question and answer session to David Kivo, my colleague and our Chief Development Officer. And David, why don't you take it from here?
Yes, hello to everyone from wherever you may be, and I want to echo the words that Michael and our honored guests have shared, that we hope that you are keeping safe, and our hearts are out to all of you as part of our Technion community. The way I'm intending to go about these questions, and thank you for all the questions that have been shared, is to group them along common themes that have been shared by all of you. So thank you, and keep the questions going. The first and by far the most dominant question, of course, is around the hope and the promise of developing a vaccine. So Avi, I'll share the question with you in 3 or 4 parts, and you can answer it as best as you can, of course. So please talk to us about the process of developing a vaccine. What are the research steps that are involved? What kinds of collaborations is the Technion involved with other institutions, with industry, across borders, the timeline for developing a vaccine, and give us hope. I'll turn it over to you.
Yeah, so I'll first start with hope. And I want to say that I think everyone on this line understands, on this phone call, understands that we're all full of hope, and that this hope will be fulfilled. It will come in a rather short to other issues, and I'll try to explain why. I did want to touch, though, just before I begin, 2 points that Linoy and Ido mentioned, and to give one example, and I think I feel really proud to be part of the Technion at this time, and it's our student bodies and the way they help each other, and it's also the leadership of the Technion, which is showing amazing responsibility. I have to tell you, the messages are clear and simple to understand, but also very, very well thought of, and every issue is thoughtful, and in these hard times, having such a leadership makes you feel really good. And I have to say that we have a rather new leadership at Technion at this time. And it could have been very challenging because everyone's new to their job and they're just dealing with everything amazingly. And just one example is I have in our lab, we have a foreign student from Spain. And I asked her if she wants to go home and join her family during these rough times, because we all know it's rough not only here, but it's rough also around the world. And she said, Avi, even though I'm alone in the dorms here, I don't feel alone. Every day I get 10 phone calls from my colleagues in the lab and other labs asking me if I need something, if everything's okay. And actually, I feel so much at home here at Technion and so safe here that I don't want to risk getting on a plane, going to an airport, even though it means going back to my family at these times. So I just think that for me, that explained everything. Wanting to stay here at Technion in Israel during these times. So I'll go back to the question about where we're standing regarding developing a vaccine and how we actually address that. So the first thing when you want to develop a new treatment for a disease we haven't seen in the past, is trying to get as much information as possible. And we all know that today that COVID-19 is what we call coronavirus, is about 300 nanometer virus. That's the size of it. It's about 1/1000th the width of a hair on our head. That's the size. And inside this viral envelope, which looks a little bit like a porcupine from the outer side, and everyone saw these pictures on the news, inside sits a molecule of RNA. RNA is a genetic material. Our parents inherit to us their DNA. That's what we got from our parents. That DNA is then transcribed into RNA, and then proteins are produced based on this RNA transcription, which occurs. The virus hijacks our cells, enters the cells. It begins from the lungs usually. It hijacks the cells in order to produce many copies of the virus, which then explode from that cell and infect another cell. They multiply again in this the new cell, and then they go on, and that's why we become sick. So first, the most important part is really understanding what is unique about this virus and why our body doesn't detect it immediately and destroy it. And that's where also the opportunity comes to come and develop a vaccine. And some approaches have been trying to block where the virus harbors onto our cells and enters our cells, penetrates them, or at trying to detect it before it even penetrates the cells. Our approach is an approach which won a Nobel Prize several years ago, not by us, by other colleagues around the world. It's called RNA interference, or known also as short interference RNA. And what it is we use RNA molecules to actually stop the ability of the virus to multiply inside our cells. We utilize a unique mechanisms our cells have for protecting themselves from viruses in order to identify this specific virus as it multiplies inside our cells, and then we stop the multiplying of the virus inside the cells of the body. By that, we reduce the viral load, and we also prevent people from becoming infected. So people that are healthy, if they're treated by this type of vaccine, they'll be protected. The virus will not be able to multiply inside their cells. And regarding the timeline, how long does it take to develop a new vaccine? It all depends on the science that's around it, and that of the risk that is associated with the development. We in our lab always try to take an innovative path, but one that also we understand what the regulatory bodies will be asking us, and how can we actually present this as the most to the regulatory bodies. And we chose this mechanism of RNA interference, which the regulatory bodies are aware of. They've approved already several medicines based on this mechanism, and that's why we believe that it will have a faster track towards clinical implementation. I'll say that the United States, there are already some companies, Moderna, which many of you have heard of, has already initiated a clinical trial very rapidly. So in general, either from our lab or from other groups around the world, I'm very confident that we'll see a vaccine or a treatment coming out in the near future. We all understand how important it is. And I'll only say that we cannot do it alone. One, your support is crucial for supporting these activities, but more than that, it's your friendship and partnership and support as evenings like today, knowing that we have friends around the globe. That's what really helps us when we work in the lab. That's what motivates us to come in and do this research, knowing that we're all thinking about the same problem. We all understand how important it is, and we all have to have a cure. So I think that's what also motivates us so much. And we work with partners, other universities in Israel and outside of Israel. We work with companies. At this time, no one is allowed, or at least I don't believe it's the right way to say, oh, we'll keep all this only for us, and each one will do only small segment. That's not the way to approach it. We're trying to, and we're creating the largest as possible consortiums, we call them, or collaborations, which leverage the strength of each group in order to bring medicine as soon as possible. We can't lose any time. My colleagues, medical doctors, always say, you know, any day we wait is one too long because a patient is waiting for it. And we all know around us how severe this virus is actually attacking. We can't wait any extra day. We have to work as fast as possible.
Avi, thank you so much for that wonderful and complete answer. The next thematic set of questions have really been around your research and as it relates to our food supply, our food intake. I'm wondering if you could share a couple of things. First of all, are there any learnings from what you have done around crustaceans and shrimp specifically that could be of benefit to humans? The second theme that has emerged is, are there any foods that we should avoid? If the IDF is avoiding processed foods or fresh foods or something like that, are there any lessons of what we should not be keeping in our fridges or eating?
Yeah, so one, I'll say that we're very much learning from what we did for treating shrimp to treating people. And I'll say on two fronts. So the first and fastest way to vaccinate humans is through an injection. But when we went to treat the shrimp, we couldn't inject them. They're just too small. So we developed or invented a special feed that the shrimp eat, and it vaccinates them through their gastrointestinal tract. And so while most of the work is being done around vaccination, I truly hope that we'll also be able to have foods that will protect us from viral diseases, food that we'll be able to eat at home. It will boost our immune system and actually make it strong enough to deal with viruses such as COVID-19 when they come and attack us. Regarding what foods we should avoid and what foods we should be careful of. So I actually think that what we should be most careful of at this time is washing the fruits and vegetables we consume. It's very important to continue eating fruits and vegetables for boosting our immune system and also for our health. Having that said, if you buy, for example, tomatoes that someone may have sneezed on, sorry for the description, but it's true. Please wash your fruits and vegetables with soap at this time before you consume them. For other foods we bring back from the supermarket, try to take one from the back of the rack so that as few people touch them. And furthermore, I would even say if you bring something back in a bag and it's something that can, such as I would say maybe a cookie box or something like that, or a box of cornflakes, maybe wait a day or two before you open it, meaning that if it has the virus on it, then waiting a day or two will most likely get rid of most of any remnants of the virus that may be on the surface of the food content. Will food give the virus? So the best way to avoid getting a virus from food is by cooking it. And if there's anything such as this is not the time to eat raw meat or raw fish, try to eat all your food cooked. I'll say that in the IDF, they took this recommendation to the far extreme. So what we're eating is overcooked, I'll just say that. I didn't want to keep evidence to show you, but you guys can imagine.
Thank you. And a follow-on question that a number of people have been asking. We've heard today from the US president and from other people as well that certain older drugs, such as anti-malaria drugs, are showing some promise. A few weeks ago, we heard that plasma treatments in China were showing some promise. What are your thoughts on these types of treatments and other experimental approaches to fighting COVID-19?
Absolutely. So there were reports from China several weeks ago when this pandemic actually broke out that certain patients that recovered, their plasma was taken, and antibodies were actually taken out of the blood or the serum of patients that recovered, and were given to patients in the intensive care who recovered based on this treatment. So taking the antibodies at a patient that recovered from COVID-19 and giving them to a patient that's in a severe critical case, help them. It makes sense. I have not seen the exact scientific evidence about this, but that does surely make sense. And regarding the repurposing of older drugs, such as drugs that are used for treating malaria or other antiviral drugs. So I'll just say that the drug that's used for treating malaria has very harsh side effects. That's why it hasn't been used widely in the Western world over these past years. But of course, for a patient that's in a severe, in a critical situation, this makes a lot of sense. Hospitals all around the world, in Israel and outside of Israel. In Israel, we have been using an anti-malaria drug for treating some of our patients, and also other antiviral medicines. We're trying to get it's rapidly presented on the web, and we'll be able to know in a short time which medicines are more effective and which are less effective. Having this said, though, we all understand that this is early times of COVID-19, meaning that we don't understand more than we do understand. Especially, what we don't understand is why certain patients respond to COVID-19 in a more severe manner than other patients. Why are some patients recovering really quickly? Why are young people such good carriers of the disease, but actually they don't present the disease they don't present the symptoms. They only harbor the virus inside their body. These are all questions that we do not know the answer to. And so actually around that, these are issues that we're all waiting for science to come and actually respond to.
Thank you. And the next set of questions that I've been hearing from our participants really have to do with what you just spoke about, the younger population, but actually more specifically our older population. And Avi, you referenced how we should love our older generations, but from a distance. Yet, what we've been hearing from a lot of people on this call today is that may not always be possible. We may have elderly relatives who need caregivers, who need support in their homes, who cannot avoid having that kind of physical contact because without that, they're not able to live, they're not able to eat. So the group is really asking for your advice and insights about how to keep our elderly population safe while having those needs.
Yes, so absolutely. I fully appreciate that question. And I'll give maybe one example from my own parents. So my parents are, I won't disclose their age because my mother will be very angry at me. They're young at heart, but they are a couple of years older than I am. What my parents are doing is they actually close their home, they exercise at home, and they have food delivered outside, and then they bring it in. Thank God they can actually take care of each other. But we also supplied them with masks in case one of them becomes ill and will need to take care of the others. However, in many cases, this one person lives alone, or the couple itself needs help. And I think in this case, we need to be most careful, especially making sure that the people that come, the caregivers, are not infected by COVID-19 and they stay at home with these adults, or if they have to enter from outside, that they wear a mask and they wear gloves so that they don't come, they have minimal ability to transfer the virus to the adults. Keeping the health of the adults is of utmost importance at this time. If we cross this COVID-19 pandemic by infecting less adults, we'll be saving lives. We'll be saving lives. And what it means is that if adults need to have care from the outside come in, please make sure that these caregivers wear a mask when they come in and wear gloves when they come in contact. And and even more, if they can wear other protective clothes, such as a protective coat or something similar, that would be even more important. So all these measures should be taken care of when we come to deal with the adults. I fully understand that many people need help at home, and let's try to minimize it and also make sure that the people coming from outside don't risk our elders and loved ones.
Thank you very much. The next grouping of questions is actually for Linoy and Ido. So what we're hearing is that many people on this call will have children or grandchildren or other loved ones who are part of the younger population. They may be on campus or presently leaving campus and back home. I'm wondering if you can share how many students are still in their dorms and how are they being supported, given that they're far away from their families and their families may have needs as well, and the students may have needs. I know that you touched upon it, but there's still some interest to learn a little bit more about how the Technion student population is faring right now.
Currently, all the dorms are with students. There is about 5,000 students here at the campus. And also there is students outside the campus. Here at Haifa, it's almost the same. So we do a lot to be a community, to talk with each other, to help to each other. There is students that have many issues with access problem, and we do a lot to give the solution to every student. For example, we have a blind student that need help in his home. So we talk with him, and of course with the Technion people. We have a psychologist of the Technion, and we do our best to give all the information for the Technion people, and do our best to help them as a union.
Ido, anything to add?
I think it's everybody understand that it's a unique and a strange era, and I want to connect with what Avi said at the beginning of the chat, that to send our love through video, through Zoom, through calls, and we encourage the students that living in the dorms and living in throughout Haifa to reach their parents, to reach their friends. And like we said, there is we didn't imagine that there are so many activities that could be done through Zoom. Even bands that play together and with people watching, and storytelling and games throughout the camera.
Shachmat games.
Yeah, and it's every day we got surprised how many things you could do throughout the camera. And yeah, it's a virtual era. Many students in the dorms, I know that they don't come back home because they don't want to expose or to put their parents in danger. And I think the best thing that is done, it's like a hive mind. We are all the time speaking and getting new ideas and learning from each day and from each student that they want to give us new ideas. And it's I'll say for last that I think it's interesting days.
I have two more examples. Our debate team have a training today, and we want to do it public on Facebook or on Zoom. And right now, I had a message from a student who asked me, why can't we do a party on Zoom? So I think we're gonna do something like that, like this, to open the semester, the spring semester. Usually we are bringing here bands, and we are doing many parties. So this spring, we're gonna do it on Zoom or Facebook.
Well, we'd like to be invited to that party as well, of course. So,
Okay, don't worry.
Please include another 225 people or so to your party. But the last question before I turn it back over to Michael, and really thank you all, is interestingly enough, we have people from all over the world, from of course the US and Canada, from Mexico, from parts of Asia here. And one of the questions that's come up, and this is not a philanthropic question, this is a question really from the heart, is that we want to be a community for the Technion. Avi, you've touched upon it as well, yet the question keeps coming up. What is it that you need from your friends across the world and here in the US to help you and support you at this time?
Yeah, so I want to start with 2 points. So one, I mean, you heard our students, our student leadership, Linoy and Ido, they're just amazing. I mean, with students like that, you want to come to work every day and just meet with them, because they're just so fantastic, forward thinkers, creative, great, just they make the lemonade from the lemons every time. The second thing is really, what really is most important for me now is that each and every one of you on this call, wash your hands before you eat. Keep your personal hygiene. Love your family as much as you can. That's what's really most important, that we cross this pandemic with as few casualties as possible. Everything else will work out. And support, we all know every person supports the way they can. I do science, and now I'm doing some IDF service. Our students are amazing, creative, motivating, constantly thinking about the next technology. Every person, really, we welcome any type of help at the Technion, and we're a community. I would say we're a family. We're a family. We love each other very much, and in a family, we help each other as much as we can. And I want to extend wherever we can help as Technion, the Israel Institute of Technology, wherever we can help around the globe. Please call us, send us an email. I promise you'll get an answer from any Technion person. And If he or she cannot help, then we'll pass it on to someone else who can help, and we'll do our best to push forward. So whatever you think you want to contribute to each other to help, that's great. But please, most important at this time, keep safe. Keep safe, and let's continue pushing forward, because there will be life after the corona. Sometimes it seems, some days we turn on the news and it seems that the world is coming to an end. It is not. Look at the numbers, they're getting better. It's reaching the United States now, and the Americas. The Americas, we're very concerned for you, our friends that are over the sea. And that's why I ask, please stay in quarantine. It's working here in Israel. Thank God we haven't lost one patient in Israel yet to coronavirus. Unfortunately, there's some that are on extremely intensive care, but we're already 1 month into this disease. And if you compare the size of Israel to other countries around us, such as Spain or Italy, or even other countries, but Spain has about 50 million people, or 45, and Italy has 50 million people, if I remember correctly. And they're around 300 to 400 patients that are passing away every day. In Israel, we haven't lost one. That means that we're ahead of the game. And the only reason is that we're taking this extremely seriously. And I want each and every one of you to please take this pandemic seriously, so that we can laugh together, hug together, and even maybe give a kiss on the cheek this summer when we see each other after this pandemic is over.
Thank you. Beautifully said. Before I turn it over to Michael, I just want to say that to the three of you, we really appreciate the insights and comments you've shared today. You know, when people talk about Israel, we often speak with many voices, yet what's really been special about the Technion community is that we always speak with one voice when it comes to the Technion. I'd like to add to that right now we feel with one heart for all of you at the Technion, and we really thank you for wonderful presentations. I now turn it back over to Michael Waxman-Lenz, the CEO of the American Technion Society.
Thank you very much, David and Linoy, Ido, and Avi. I just want to reiterate what David said. Thank you so much. We love your work. We love your attitude and spirit. Thank you for more than 200 participants on this first ATS webinar, which I'm really proud of. And I hope you found it as informational, inspiring as I did in these, uncharted times and of uncertainty. We look forward to having you join again next week on Wednesday at 12 p.m. to hear from Professor Asia Rolls from the Technion Faculty of Medicine and listen to this topic. She will talk about her research of the effect of emotions and thoughts and stressors on the body. So I think her research is somewhat relevant right now. And so we hope that you can again join at this time. We will send you a registration information tomorrow. Thank you so much for joining. Stay healthy, be well, and follow all the good advice that Avi gave us. Thank you so much and have a wonderful day. Thank you.
See you on Zoom party.
Bye-bye.
Bye.
Bye. Shalom.